Hi. Welcome to The Buzz on Business. I'm Ken Schlick, owner of Imperial Pest Control and a board of director of Chamber of Commerce.
Hi there, I'm Claus Meyer. I'm a financial advisor for Edward Jones and also a member of the board. Join us next for The Buzz on Business.
Welcome back to The Buzz on Business. We have Rob Stahl from Medina Hospital. Rob, tell us a little bit about yourself.
I'd be delighted to, Ken. I've been with the Cleveland Clinic for 27 years. I've been, Medina Hospital now has been part of the Cleveland Clinic for 18 months. And so I came on board as that transition occurred. Before Medina Hospital, I was the president for Euclid Hospital. And before that, I was the division administrator for regional medical practice, those 14 family health centers you see around Cleveland, Ohio. Yeah. When I'm not doing that, Ken, I'm an Army reservist, and so I'm a major general, and I'm a commander for the 108th Training Command located in Charlotte, North Carolina. And the command supplies half the drill sergeants for the United States Army.
Wow. Incredible.
That's a pretty good background.
Yeah.
18 months now. What brought on the merger of the Cleveland Clinic with Medina Hospital?
You know, Klaus, as you know, healthcare has been evolving, and it's becoming more and more difficult for physician practices as well as hospitals to kind of stand alone and to do their own thing. I think Medina Hospital realized that a couple of years ago, and they were looking for a partner, someone that could provide expertise, provide the depth that they were looking for. And we were delighted to take a look at Medina Hospital because of its location and what a great community it's in. Mm-hmm. And so it eventually evolved, and so we consummated that relationship last August or in 2009. Wow. And for the last 18 months, we've been working to provide the very best health care we can for Medina County and for Brunswick.
Yeah.
Rob, what kind of projects or goals are you guys working on right now?
Over the last 18 months, Ken, we have done a number of things. We've worked on the South Office building and kind of spruced it up and renovated that. We've worked on our IT platform. Medina Hospital was kind of positioned as an independent hospital, so it didn't necessarily have a robust IT platform. And so we, over the last 18 months, have put that platform in so that we could put electronic medical records for the community in. And so last November, we completed that project. We are still working with the emergency department, the ORs, and putting several other software programs in so that we can more seamlessly move information back and forth throughout the hospital, and again, move into that era of healthcare where the electronic medical record will assist us in providing the very best healthcare for our patients in our community.
So, what are some besides the electronic records? What are some of the other innovations we're hoping to get with the merger?
Klaus, we have just we're in the process of putting a brand new MRI in that's state of the art. We're putting in digital mammography. We've already put, from a physician perspective, we supplied the hospital with hospitalists, so we have a physician 24-hour presence. We have, nocturnists in the evening, so that there is a on-site physician at all times. We have the ICU is now fully staffed with with Cleveland Clinic physicians. And we've also looked to, we've asked the community what they needed and what they wanted. We have centers of excellence in orthopedics, in women's health, in pain management, in neurology, anesthesia, and some of the other specialties that will be coming in, to address some of the growing needs of Medina County and Brunswick.
Wow, a lot of new innovations.
Yeah, we're having a good time.
Sounds pretty exciting for with the merger here,
Yes.
and another question kind of came to mind also. I've noticed, had a couple of opportunities to visit the hospital, very friendly staff, and you think that's going to, sometimes when you get a merger, sometimes, it can be difficult, but it seems like that's working through and people are pretty friendly with that. Why do you think that is?
We've worked very hard with the staff at Medina, and I will tell you, the physicians, the nurses, the health caregivers, the administrative staff, great folks, and we want to perpetuate that and make sure that we don't lose that feel, that touch. It's that touch that really puts our patients first. And from Dr. Toby Cosgrove on down, we work very hard to make sure that we are there for the patients, and that we make sure that we do, for example, we do nurse rounding, so that the nurses round on our patients on the hour. We work very diligently to make sure that our patients feel at home, even in a hospital setting. There's a lot of apprehension, a lot of fear when patients and families come through our doors, because they're there because they're sick or they're in need of health care. And so we want to do the very best job we can. So we're working hard at not losing that touch and that feel.
All right, very good. Thank you, Rob, for coming to our show today for Buzz on Brunswick. And next, we're going to have Terry Radick from Tri-C.